Okay, ladies and gentlemen, so we're going to finish up this karyotype packet that you had out earlier today. And we're into, I think it's the third page, about different chromosomal abnormalities. And the reality of this is the ones that are highlighted are going to be most important to you. These will be the ones that you will probably see on your test coming up on April 7th. If you don't understand any of these disorders, go on YouTube, start looking things up, find some examples of. So Klinefelter's is a male who is 47 chromosomes because he has an extra X chromosome. One of those X's is going to get shut off and become a bar body. Pretty much they look like a normal male. They're usually long and lean, and they may have the development of breasts and some difficulty with sterility issues. Karyotype we talked about earlier today, a partial deletion of the short arm of chromosome number 5. So mostly in females this happens. Again, get online, look someone up that has Karyotype so you have an idea of what the disorder's characteristics are. Turner syndrome. We've talked about a female missing an X chromosome. You only need one X to be a human. So it is the Y that determines maleness. The other X also would get shut down as a bar body. Again, we have women here who have infertility or fertility issues. They usually have a cardiovascular issue, which leads to an earlier than normal death. Their body is a little more barrel shaped, so they're short in stature. Triple X females due to a non-disjunction. So Klinefelter's, Turner's, and Triple X so far are all non-disjunctions. Chromosomes didn't separate properly during meiosis, and therefore a fertilized egg that happened got too many or too few chromosomes. Again, pretty much normal. Most women who have Triple X probably don't even know they are one unless they have some type of genetic testing done. Trisomy 21 we know as Down syndrome. About 1 in 800 children born are Down syndrome children. Male to female ratio about equal. There is a form of mental retardation. It can be very slight to more severe. Again, the real issue is typically a heart condition. These children are probably the loveliest, squishiest, most happy people you will ever meet. But again, you can see some of the symptoms of the disorder. Others that you will become familiar with, trisomy 18, also known as Edwards syndrome, an extra 18th chromosome, and trisomy 13, Patau syndrome, an extra 13th chromosome. All of them on this page, except for Karyotype, are the result of a non-disjunction. So that's something you should become familiar with. When you flip to the back side, we are working with autosomal dominant conditions. Autosomal means body cells. So these are chromosomes 1 through 22, and you would only need one of these dominant genes to have this disorder. Again, you certainly can read. We're going to flip down to Huntington's, which we spoke on the other day when we were looking at human chromosomal disorders. It's a progressive degenerative nervous system disease. We're also looking at polydactyly, extra fingers or toes. The Amish population often has many people born with polydactyly, so it typically looks like an extra pinky. Their hand is a little wider. It is all functional. So polydactyly, poly, many, and fingers. RH we've talked about already. And again, read through. The highlighted ones are probably the ones that you will see again on a test situation. The next example page is for autosomal recessive conditions. So neither parent has to have the trait here because they're passing on a recessive gene. Again, autosomal meaning not the sex cells or not the sex chromosomes, chromosomes 1 through 22. Albino, these are people who do not have melanin, so the pigment of their skin is very, very fair. Their eyes are very blue. Their eyes have a tendency to jiggle back and forth because the musculature around the eye is not so strong. Typically in humans, it is not a pink eye as you would see in animals that are albino. It is a blue eye. Problem, shorter than normal life expectancy, often things like skin cancers because without the melanin, their body cannot protect itself from the rays of the sun. Cystic fibrosis, again, autosomal recessive, so neither parent has to have this condition in order for it to happen. This is when mucus will fill the lungs. It is difficult for these people to get this mucus out. There's usually a pounding technique that has to happen to remove the mucus from the lungs. There's a horse farm not too far away that they do treatment for people with things like cystic fibrosis because the pounding of horseback will loosen this mucus in their lungs. They also need to take digestive enzymes because there is a digestion problem. Again, you can read all about these. I think an interesting one is maple syrup urine disease. Happens very early in child's development. You can actually smell urine that smells like maple syrup. PKU, we talked about on our human notes. Phenylketonuria, there's a buildup of phenylalanine in the blood. It causes a deterioration of function and leads to a form of mental retardation. Totally avoidable if the diet is free of phenylalanine. Sickle cell, again, we talked about this ages ago. We have abnormal hemoglobin. It actually looks like the shape of a crescent moon. It's going to clog up small blood vessels over time, causing pain and eventually a sooner than normal death. Tay-Sachs disorder, cherry red spot is the first sign of this. These babies are born normal, happy, healthy. They start to hit all of their developmental milestones. Somewhere around 6 to 9 months of development, they start to have a deterioration. The first sign is usually this little cherry red spot in the eye. It kind of resembles something like a red eye spot. And these children often die within the first 2 to 4 years. Many of these disorders' lifespan has been improved because of different medications. All of these are autosomal recessive conditions. Also in this list of autosomal recessive, so neither parent needs to have the condition, is xeroderma pigmentosum. This is children of the night. They cannot be exposed to ultraviolet radiation because it leads to skin cancer and, again, shortened lifespan. So you can please look up these disorders and find more information about them. X-linked or sex-linked disorders that are recessive conditions. So again, a list: Duchenne muscular dystrophy affects primarily males. And the reason is you would only need one bad X, so to speak, or one X that is carrying this disorder in order to have the disorder. It probably came from mom because that is how males get their X chromosome. Hemophilia, the lack of active blood clotting factor 8. There are several types of hemophilia. Hemophilia is not so much, oh, I'm going to get a cut and bleed out. It is often, the problem with it is internal bleeding. So you bump your kidney against a lab table and you start to bleed internally, and that's where the issues come into play. Again, color blindness, X-linked, more males than females are colorblind. It doesn't mean that females cannot be. Their dad has to be colorblind. They got the colorblind X from their dad. They get a colorblind X from their mom. And there are just a handful of X-linked dominant disorders. Again, you can read about them or look them up. The disorders that have been highlighted on this list of disorders are the ones that you are going to want to be familiar with for your test. So when you look at your review sheet, that is where you want to kind of focus in on. These are the disorders that I need to know about. Have a good day.